Okay, good morning everyone. Morning. Wow, we have a full house. Okay, we're going to start because we actually have 45 slides, which I don't think I can cover in 75 minutes for sure. Right, so just bear with us, right? I think you will be enjoying this. Okay, so let's get started very quickly, right? So the title, I hope you know what is this workshop about, right? It's actually from data to AI agents, right? How to scale and deploy AI in healthcare and be able to scale it. So maybe very quick introduction of myself, right? This June here, right? Long one, I wouldn't go through all the details, but basically what makes me eligible and be invited to conduct this workshop, right? I have been in healthcare for the past 8 years, in ICT for 26 plus years, right? And I was the founding CEO of Grab Health. So for those of you in Asia, you probably know Grab. Right, now, of course, we launched it as a brand in Indonesia, and mainly in Indonesia we call it Grab Health, but actually the company is called Good Doctor Technology, which is a joint venture between Ping An Good Doctor from China, Grab, and SoftBank. Yeah. Now, of course, after that, due to COVID, I come back to Singapore, and I've been staying here for quite some time. Right, I've been doing a lot of public health related stuff. Yeah. Okay, we can catch up later, right, for business more. So very quickly, again, this is about AI, right? So what makes me eligible to talk about AI? Right, actually before all the ChatGPT and generative AI become popular, I already started teaching, created a course and teaching AI and robotics in Ngee Poly, okay, back in 2021. Okay, and of course after that, I do a lot of AI and healthcare talk. I was involved in Ping An Good Doctor, as I mentioned, which is Grab Health to those in Southeast Asia. Right, I was advisor to Babylon Health, which of course now the company already defunct, right, after the SPAC listing in NASDAQ. Right, and when I was in NCS, I was doing a lot of public health AI related work. We actually launched this AI schedule optimizer, right, in SNEC, Singapore National Center, to match the rostering as well as the availability of the different stations in the hospital itself. And then we do fall prevention using AI as well. Yeah. Then I'm in the board. I actually brought the product here for those interested to take a look. Right, I'm actually in the board of two health tech companies in Singapore. One is called Space Tech. It's an NTU spin-off. The founder is a professor still, emeritus professor of NTU. But this one do early prevention of the heart disease and hope. But it has been not FDA, sorry. It has been HSA and BPOC in Indonesia certified. And now the professor, the CEO, founder just went to US 2 weeks ago and UK last week, and this week in Indonesia, so he couldn't come. Right, we are actually scaling it to some extent. Yeah. The other one is EXA, which I'm wearing. For those that in Singapore, you will know this because Health Promotion Board, which is part of the government body, gives this wearable to all the residents in Singapore, which actually measure your steps, measure your sleep pattern, your SpO2 and other things. But that's beyond that, right? This is from consumer health perspective. We actually launched what I'm wearing here, a Core Smart Ring, which is probably similar to your Aura Ring, right, from US, but this is a Singapore-made one. And one great thing and differentiator is that they actually do the pre-diabetic and diabetic screening, right? So it's not really a blood glucose because it doesn't take blood, it doesn't prick you, right? But based on the AI algorithm and the different measurement we have, actually can do a diabetic screening. Yeah? Okay, and of course doing multiple different health work, teaching also AI in SUSS and NUS. Okay, and EXA, that's the latest one that we are launching. We have launched this course on Ring. Yeah. Okay, very quickly, although I was invited as a speaker, and then just a few days ago I talked to the organizer to say it's quite boring to just listen to me for 1.5 hours, right? And then we are talking about scaling. We are talking about things really making it happen rather than on theory, on paper, teaching. Although I teach MOH, I teach 25, I think 2 gentlemen there was with me. We actually helped the Ministry of Foreign Affairs to conduct a public health informatics and telehealth course to 25 countries MOH, right, from the Middle East to European to African countries. So we actually conducted that to 25 delegates from MOH all around the world, right? But I actually invited 4 guest speakers here because unfortunately I got to run for a quite important lunch meeting after the workshop. So these 4 gentlemen will be able to answer most of the questions, right? So we have Zach. Maybe Zach, you want to just show your face and raise your hand. Right? Zach is actually the co-founder of Marymount Labs, which is actually really putting AI into use, as well as later on we talk about the 4 layers of scaling AI healthcare projects or products or companies in the healthcare ecosystem. Zach is actually a living example of that, and that's why I invited here. Then we have Aristotle, right, from NUS Medicine, data. Right, data is not your data, right? It's actually digital advanced technology accelerator, which will give some brief explanation to that. So for those of you who are from the startup scene, you want mentorship, you want to be able to join hackathon, have programs beyond just a normal mentorship, right? Talk to Aristotle. He will brief you about what data do. Yeah? And we have 2 gentlemen here. One is Wei Hao, right? He's representing our company, Five9, but as well as GPT Bots, which is the agentic AI company that he will share some demo later on as well. And also our friend from InterSystems couldn't make it this morning, so we are actually covering for them. And for those of you who don't know InterSystems, it is actually the underlying data platform for Epic. Right? Epic is the entire EMR that Singapore is using. So you can imagine all of our data in Singapore, in terms of healthcare, is collected in the InterSystems data platform. Okay, that's how big they are. And of course, Don, he will not be presenting today, right, because we have very packed slides, but he'll be able to answer a lot of questions about AI as well as Five9 itself. Okay, and we just concluded a project with a big US giant in the infrastructure space yesterday. Right, that project actually helped the US infrastructure giants to do research into APAC and EMEA, as well as the go-to-market strategy. So that's actually what we do for many of our customers as well. Yeah. Okay, very quickly, very packed agenda, right? I'll try to keep it short. Right, so that's me. I realized that when the organizer invited me to talk about scaling in the healthcare ecosystem, because it's very difficult to scale, I realized that I actually did something similar last year in the Zoker forum where I actually organized this more health ecosystem day. There's a YouTube link here. A full video of about 1+ hours is actually there, you can take a look. So I actually invited a very prominent figure, right, from the Chief AI Officer of SNEC, Daniel Ting, right, who's also the Director of AI Office of Singtel. We have Peter Fox, the Group Chief Digital Officer of NUHS. Then you have Mike from Korea/UK, right, he's leading a lot of global initiative and he's in Latin America now. Right, signing some venture. Pauline from NHIC from Singapore, you will know that this is the government body that actually support and sponsor, give grants to many healthcare startups. And Chet, who is actually my fellow in Good Doctor when we first started it together, he was my COO, right? So both of us actually started the entire operation, and now he's with a VC from US called Medical Ventures, which is also a partner of NUS Data. Yeah. So you can take a look at this video, right? You can drop me a note as well. I'm on the apps for GITEX, right? So I can send you the link as well. Yeah. So today we'll talk about what is the reality of healthcare AI today, right? In probably Singapore, APAC, and also the world. And then we'll look at why most AI projects fail, right? You may disagree with me, but we can have a discussion on that, right? Then we look at the end-to-end healthcare AI stack, right? And then data governance, because I realized this year GITEX, I was actually a speaker as well as a moderator last year in 3 panel discussions of GITEX. This year they asked me to conduct a workshop, right? And this year focus is very much on the AI and cybersecurity, right? So we will definitely talk about data governance and trust. And then we look briefly about AI, Asia opportunity for AI in healthcare. Then we'll kind of conclude, right? So we all know we need an ecosystem to thrive, right? Especially in the startup world and any innovation. But ecosystem here is not just ecosystem. You'll see what ecosystem means, right? Breaking each of the alphabet into different meaning. Yeah. Okay, stop me anytime if you have any questions, right? It's supposed to be a workshop and interactive, not a one-way presentation. Right, so maybe just do a quick poll, right, by the raise of hand, so that we know who are the audience. Because I asked, they say 1,800 people buy the tickets, right? They don't know who is coming to which workshop, so we also don't know the profile of everybody here. Okay, so maybe how many of you have an existing AI project or company? Maybe raise your hand. Okay, good, quite a lot. Okay, how many of these are in healthcare space? Okay, slightly less, probably about 10 to 20% of those who raise hand for question 1. Okay, how many are working in the healthcare ecosystem players? It can be hospital, medtech, pharma, research, Not many. So the rest are trying to get into healthcare. Or trying to understand what healthcare is. Okay, good. And how many are working in the hospital now? And how many are working in the hospital first? Nobody. So those raise hand for healthcare, you're not in the hospital, but maybe in pharma, medtech, research. Right? So how many are clinicians? Doctors, nurse, therapists? Only one. Okay, doctors don't like to attend such seminar. No time. Okay, good. And maybe the last question, right? How many of you think that, especially for those of you doing an AI project or having an AI company, how many of you think that you have been quite successful, right? It can be adoption, it can be scaling. Or maybe you've got billions of dollars funding. Raise your hand. Oh, one, okay. Maybe you can share with us later on. What is your AI project or company doing? Yeah, very interested to know. Okay. So I can see that not many of you are from healthcare, right? And this topic is very healthcare related. Bear with us. Feel free to ask any questions if you don't understand some of the terminology or acronyms that we're using, right? So let me just go on quickly, right? So application of AI in healthcare ecosystems, right? Since not many of you are in healthcare, I will just go very briefly on that, right? Actually, AI is used everywhere, right? Every industry. And healthcare is not spare of, definitely is one of them. But everybody, if you are in the healthcare industry, or maybe if you are doing startup, you try to enter the healthcare industry, right? You feel that it's very difficult. Why? It's one of the most regulated industry, right? Besides banking, which is more financial security, this one touches one very important thing called patient safety, right? If you do anything wrong, you may cause a death. Right, so not many people dare to do AI in healthcare. But of course, there's another angle of looking at it, right? So you can look at operations side of healthcare, right? Hospital bed management. These are less so-called sensitive and less risky, right? But actually, the most important and most, I'll say, promising AI projects or any innovations in healthcare is actually touches the clinical workflow itself, which we'll see later. And clinical workflow usually will touches patient safety, which is very important. Yeah? So even before I do any AI projects or any systems in healthcare, I always tell my guys last time, people ask, what does it take, right, to be able to work in the healthcare industry, right? Do I need to get healthcare knowledge or I just need to have IT knowledge? I say all these are good. You can learn about it, no problem. But your mentality is the most important thing, right? You must be passionate and you must always put patient safety at the first place, top most important, even if there are technologies, right? It's not just the doctors or nurses, right? Whatever systems we develop, whatever apps you want to plug into the healthcare industry or ecosystems, everything that you do may impact patient safety. So if you don't have the right mindset, please don't do anything in the healthcare industry. Yeah? Okay? So if you look at healthcare ecosystem, it's a very big ecosystem, right? Healthcare is not just hospital, healthcare is not just medtech and pharma, although these are the three dominant players in the healthcare industry or healthcare ecosystems. You have your research, you have your government, right? A lot of healthcare government sponsored, or you have your Ministry of Health as well, right? So it's actually a very big ecosystem in the healthcare industry, right? And we picked the three most important ones, right? One is the medtech industry. So for those of you who may have heard, there's this thing called software as a medical device that became very popular probably about 7 years ago. And many of these AI algorithm or innovation or software related healthcare innovations are actually getting this thing called software as a medical device, right? So example, you don't need to prick anymore, you do not need to do ultrasound for your liver health, right? So all these things, the AI algorithm plus other software capabilities combined together can actually allow this software as a medical device to actually flourish. Okay. The other thing is clinical pharmaceutical. So of course we know through COVID, right? How can we get the vaccine so fast, right? There is actually a lot of AI algorithm and trials ongoing to make it really faster. Then of course hospital, healthcare providers. Right? Smart hospital is one that actually has a lot of innovation, including AI in the healthcare ecosystem. And last but not least, this is very popular in Singapore and recently in the neighboring ASEAN country, right? We have National Electronic Health Record and going to this app called Health Hub. So for those visitors who are not from Singapore, look for some of your Singaporean classmates here, right? They would have used this thing called Health Hub, which actually manage our longitudinal health record. records, right, from your hospital visit to your after hospital and pharmacy. Okay? And of course, Singapore government is pushing this thing called Healthier SG program, right, which is really a population health management, right? You don't want to do just sick care, you want to do health care, right? Healthcare is not when you go to the hospital only. You need to be able to do it even outside the hospital setting. Okay. So very quickly, software as a medical device. Right? I wouldn't go through details of everyone. These are the two companies that have brought our products here. One is Space Medtech, right? That has gotten the EPOM approval, as I mentioned, and HSA. So all these are really the software as a medical device thing, and many of the healthcare innovations for the past few years that I've seen is actually doing this thing software as a medical device. Because again, you can't be bringing big devices. First, it's costly. Second, you can't bring them home. And if you want to move healthcare, or rather move from sick care to healthcare, move from hospital to into community-based or home-based care, you need a lot of all these IoT, consumer health, wearables, whatever that you give it to. Yeah? But again, you don't want to be just normal consumer health device, but you want to be a medical grade, and that's where the software as a medical device actually comes apart. Yeah. Pharmaceutical, I don't think anyone is from pharma here, right? There's definitely a lot of AI being deployed in the pharmaceutical trials, right? Because that really speed up, and that actually, I mean, there's another thing that's a little bit crossing pharma is genomics, right? So genomic sequencing and also using a lot of AI algorithm as well. Okay, smart hospital, there are two parts of hospital. As I said, if you're not too sure, don't go into the clinical side yet because it costs patient safety at stake. Right? You can start always, whether your AI projects or your operations or your innovation projects from the operation side of the hospital first, right? And this is the one that I say I was personally involved in, right? The AI rostering. You can talk to Aris because he told me yesterday that he was involved in this Tan Tock Seng Hospital C3, right? The command control center that actually look at your bed management, your flow of the entire hospital flow. So you can talk to him more about that, right? It's one of the very interesting things that Singapore has developed many years ago by ST Engineering, right? It actually monitors the entire hospital operations, right, in a smart way. And of course, today when you talk about C3, it's no longer just having a bunch of people sitting there looking at the screens and doing something, right? There's a lot of AI being deployed there to do what we call AI ops itself. Okay. Then the next one is the more interesting one, right? But the more difficult one is what I call the clinical setting of a smart hospital, right? So this, you definitely need some kind of healthcare knowledge, right? Medical knowledge, and that's why those in the healthcare sector, you probably is a doctor, is a clinician, right? We have many clinician innovations from Singapore, right? That actually go out to the world. So the one that I wanted to share a video by the co-founder Daniel Ting, but due to time constraint, I don't think I can. Feel free to log on to the YouTube link, right? He actually talked about Iris. Well, this is the poster boy of Singapore, right? The product is called Selena Plus. The company is called Iris, EYRIS. You can search for it. So it was founded in 2018, right? The paper was submitted to one of the best medical journals in the world. Right? In 2017, then they formed a few clinicians and a few investors from this company. Then it's now sold outside Singapore into EMEA, it's gotten the Europe CE mark, right? It's sold in Australia as well, so it's one of the most successful AI startup, right? To actually detect, using AI to do the screening, right? For people potential to have diabetic-related eye disease, right? So it's one of the most famous and promising poster boy of Singapore. But when we talked to the co-founder Daniel, he actually said that if he has to do it again one more time, right? He wouldn't start with Singapore, right? Maybe just get a certification here, but he probably start with Middle East, right? MENA or EMEA. One of the reasons is that we have Singapore is very small. That's something that we all know. Population size is small, market is small. Beyond the small, we actually have very good access to quality healthcare at our doorstep, right? From neighborhood eye clinics, right, to the big eye centers. So easy access. Who would want to carry a portable eye screening device with you, right? So in a big, diverse country, probably this will be a big market for that to really happen. Yeah. So there's a lot of sharing we can do with the startup founders as well. Okay. Then the last one of AI in healthcare use case is actually population health. This is something that I think Singapore government, and I understand Malaysia, Thailand, Indonesia, because we just did a project on that, right, is looking a lot from a consumer health and population health management perspective, right? Because, I mean, not surprisingly, right, globally, most of the time, we have a shortage of good quality healthcare due to clinicians, right, due to the cost of building hospitals not cheap, right, and of course, in Singapore context, the rising healthcare costs is also putting barrier to doing too much healthcare in the hospital setting. So we need to ensure the population health management is being done properly, so that you can, as I mentioned, moving from sick care to healthcare, right, you reduce from there hopefully to reduce the cost of healthcare. Right? So there will be, and there is a lot, and there will be a lot of more consumer health devices that's going to come to the market. Yeah. Sorry. Hey. Yeah, feel free to stop me anytime if you have any questions. It's a discussion. Yeah.
I just want to say the last time, false prevention, who are using it?
Sorry?
False
prevention. Okay, you may go to the previous slide. So this is the one that I was involved in. We use edge camera. We use edge camera to detect it in Changi General Hospital. Right, so you put at the bedside. On top of that is like 4 beds share one camera. You do the fall prevention. Actually, first is fall detection first, right? It's not always started with prevention. So you start with fall detection. So we actually measure what kind of angle, what kind of movement, and what kind of diseases or sickness the person have is likely to have fall detection. So again, with a lot of data from the camera already, then you try to detect it, right? And then you see the pattern over a few years. Then from there, okay, after I detect, I come up with a model already, I can start doing prevention, right? So if someone is moving and I know this movement, this angle will actually cause it to fall potentially due to the statistics, I will actually already alert and trigger a nurse to be there, right? And then from the prevention, we go into prediction, right? So actually it's a model and it's a progress. It's not straight away I can prevent or I can predict. We start with detection, prevention, then prediction. Right. So this is the one that I was personally involved in the hospital setting. This is the one that I was talking to an elder care nursing home, right? Then they told me that actually there's another, I would say, competitor product, right? But we are doing more research for the government. This is more a commercial product called Smart Peak from Malaysia, right? They can actually do some kind of detection as well. Singapore actually, we have another product, suddenly slipped my mind was the name, that is actually deployed across more than, I would say, Singapore has about 9 tertiary hospitals. So, 9 hospitals, right, about 4 tertiary hospitals. We have most of it, like 5 to 6 of them, I would say about 80% is already using that solution in hospital. But of course, not every ward, right? So currently, it's actually more the high dependency ward, as well as the those that need. For those of you who unfortunately have been to Singapore hospital before, which I just did last month, I had 2 surgery, right? So they will actually put on your bed, in front of your bed, right, whether there's 4 risks, right? So looking at your pattern, it can be your age, it can be the sickness you have. If you have 4 risks, you will definitely have a fall detection camera, right, monitoring that.
So with these projects, did it actually work? Did you reduce the number of falls or the number of fractured hips?
Yeah, we have collected the statistics. So it actually, the pilot started since 2018, right? So now it's 2026. So before we actually deploy it at scale, we actually have a statistic that it actually helped. It helped to prevent some of it. And that's why they decided we can't deploy it at scale. So there's actually benefits for that. Yeah, so the topic is about, this workshop topic is about scaling, right? So again, one thing you realize, scaling is also about adoption, right? Apart from ROI and other things. So adoption will only increase if the pilot is proven to be successful, right? So it takes some time. As I mentioned right from the start, healthcare is highly regulated. A lot of things that we do is patient risk. This is one that touches patient risk. If we say this one is unlikely to fall based on our model and our statistics, and the person fall, and we don't have a good explanation to that, nobody's going to adopt and scale this one, right? So this is very important. Okay, so let's move quickly, right? We have looked at some of the examples. I know I'm moving a bit quick, right? Bear with me, right? And feel free to stop me. So we look at 4 areas, right, where AI or innovation can actually help to get the healthcare innovation started, right? So one of them is MedTech, software as a medical device, and pharma clinical trials, pharma trials, the smart hospital from a clinical and operation settings, as well as the operational management. Now we look at the promise of healthcare AI, right? I mean, it's not just AI, any innovations, right, especially in the healthcare. We always want to achieve better clinical outcomes, right? Reduce errors, faster diagnostic, right? All the software as a medical device also try to do some kind of diagnostic capabilities, right? Precision treatment, right? AI or generally a lot of innovation is about personalization, right? And we always talk about precision medicine, we talk about personalized medicine. How do you actually, based on so many individuals, to give a personalized treatment? So all this, if you don't use any technology to help, it's going to be very costly. Yeah. So definitely, better clinical outcomes is one of the promise of many of the startups or innovation projects that we've seen in the healthcare space. It can be AI or non-AI related. Second one is operation efficiency, right? There is also a lot of automation, right, that's promised by AI innovations, right? And that's definitely one of the key things we want to see in the AI projects. Reduce clinician burnout, right? We all know Singapore is still okay, not that bad. But we know the doctors to patient ratio is very low in many countries, especially developing countries. We even have, I was talking to people in NHS UK, right, during COVID time. We even have to launch a mental health apps for them, right, called Sit.Life, right, because there's a lot of clinician burnout during the COVID time, right, and we see this burnout trends in many of the developing countries, right, because the doctors to patient ratio is low. So AI, in terms of triaging, in terms of automation of tasks, is actually aim to help to reduce the burnout of the clinicians. It can be the doctors, nurses, and even admin people in the hospital setting. Right, personalized patient care. So again, there's a lot of promises in the AI. But one thing that I always like to quote, and even when I wrote a white paper 2 years ago that was published, right, I always like to quote Min Ong. For those of you in Singapore, you will know who's Min Ong. He's Minister Ong, right? He's the Health Minister of Singapore for the past many years, right? So he always say one thing that you can take away from this workshop is which industry has the most number of pilots, right? Pilots, you know pilots, right? The one driving, flying your plane, yeah? So it's not aviation industry, which we all expected it to be, right? Because it's flight, it's aviation, but it's healthcare, right? Because we have a lot of pilot projects in Singapore in the healthcare industry, right? There are so many innovations, there are so many, I would say, organizations promoting innovation, right, in healthcare. So he actually jokingly said, as a health minister, right, openly in one of the forum that I attended, that the most number of pilots is actually in the healthcare industry, not the aviation industry. But that's why everybody is trying to do something, but later on I'll show you some video, probably less than 5% can scale, right, and there are many reasons to that. Okay. So, what's the reason, right? Some of the problems we have seen, right? Of course, it doesn't apply to all. I think there's one very successful AI project or company at the back, probably doesn't fall into this category, right? But, right, what's the problem, right? All of us, whether you are clinicians, which you are very familiar with your area of clinical studies, or we are technologists, whom we are the very great data scientists, or maybe we are great innovators, right? We always focus on what we are great at. AI algorithms, right, data scientists, modeling, right, accuracy metrics and benchmark, proof of concept. We like to do a lot of POC. Unfortunately, we need to do that, right, before it can scale, right, but do we just focus on that? Right, and vendor selection and licensing, then we want to negotiate with the best cloud providers, right, and all those things. So we actually focus a lot on the technical side of things. The technical can mean technology, can mean clinician, clinical studies, can mean science. right? But we always forget, or we actually didn't focus as much at the same time, right, on what we call the middle layer. So the missing middle layer here is especially AI projects, right? We all know AI wouldn't really work well if the data is not there, right? We got a lot of data, we use a lot of fabricated data, but are the data really there in terms of readiness and quality? Right, for those working in the healthcare industry, especially the hospital, you know that we have fragmented data. Singapore is a little bit lucky. We kind of, over the past 7 years, centralized into what we call one EMR, called next generation EMR, one pharmacy, one billing system, which is still ongoing. We have the National Electronic Health Record, so we are kind of centralized to some extent. But when we talk to different countries, every hospital uses their own different EMR, own pharmacy systems. You don't have a national platform to build things together. So it's never easy to deploy a project, right, that can scale beyond hospitals, right, beyond one or two hospitals. So the data readiness and quality is important. And of course, many of the clinical systems, like the electronic medical record systems, like the lab system, they have their own proprietary technology as well, right? And then they don't really allow you to plug and play easily with that. So if you don't already know the data foundation that they are running on, it makes it very difficult for you to integrate and scale from there as well. Okay? Then of course, system integration and interoperability is important. We'll look at some of the standards later on, right? For those of you who want to get into the healthcare innovation ecosystems, you definitely need to know some of this. Okay? Workflow adoption, right? Later on you will hear a short video clip from the Chief Data Officer of NUHS, Peter Fox. He used the term called ops tech, right? So this is what we mean by you need to bring your tech into the ops. It needs to be integrated. Yeah. Yeah, of course, ongoing maintenance and ROI is applicable to every innovations, not just AI projects. Okay. So why healthcare AI fails, right? We look at it, fragmented data, your different systems across all your clinical systems, EMR, electronic medical records, your PACS, which is where you do your imaging, your CT scan, your X-ray, your MRI, right? Every one of them from GE, Philips, Siemens, all have their own different standards to some extent, right? Lab systems is even more diversified, so they are siloed, right? And also we know, like I mentioned, right, your fabricated curated data is very different from production data in today's world. So how do you actually make your AI scale, right? If you launch it, you can do a pilot, you can do a proof of concept, and can you scale if you don't understand the data foundation? Interoperability, another important one. In the health industry, you will know things called FHIR, it's FHIR, is pronounced as FHIR, HR7, and imaging is called DICOM. So these are some of the global standards that if you want to be in the healthcare industry or do any AI startups or projects, you probably need to brush up some of the knowledge in this interoperability. Yeah. Workflow integration, we already talked about that. Later on, we'll show you some example, right? But one thing is clinicians are very busy, right? Whether it's the doctor, nurses, or admin staff, they are very busy. If you launch so many AI projects, they are not integrated into their workflow. They need to do what we call additional lock-in into your apps, right? Of course, you can try to do a single sign-on. Additional click, right? We always talk about this thing called click distance. If your click distance is long, right, I need to go through so many clicks to get my things done, the adoption probably will not be good. Context switching, right? People say, okay, it's okay, I don't need to integrate. I do a context-sensitive launch. I launch another window, you go there and do it, blah, blah, blah. As I said, they are busy enough, and their main job is to take care of the patient, right, and cure them. So if you add all these so-called administrative or technology overhead, the adoption is going to be low, and it's going to be difficult to scale your AI projects. Okay? And that's why we talk about adoption. Apart from all these things, change management is another key thing, right? So if you are not able to integrate into the workflow, you don't have a clear ownership because everything is defined, right? Who owns what in the current setting, right? Not just in healthcare, in many industries as well. So if you don't define it properly, right, your adoption is going to be low. And if you don't have the adoption, how are you going to scale? Okay. And of course, ROI clarity, right? So you need to get your executive sponsor, and in a hospital setting, it's even more complex, right? You probably will realize, right, for those of you who is working in the hospital setting, the hospital CEO cannot decide everything. Okay, you have your chief medical officer, you have your chief medical informatics officer, you have your COO, everybody has got different position. So it's unlike the normal enterprises that usually the CEO or the board can decide everything. In the hospital setting, it's not so straightforward. The CEO, if it's not a clinician by training, do you think that he then take any decision, right, by himself without getting the medical advisory council approval? Right, so it's a very complex setting, even in the hospital setting, and if you enlarge it to the entire health insurance system, it's going to be even more complex. Yeah? Okay, so these are what I have kind of summarized based on experience, but I don't want to be the only one telling you that. I get the authority to tell you that, right? So the sound is a bit soft, and I can go to the YouTube link again, but I just want to show you a few short clips, right? So this is one of the forum I did last year, as I mentioned, with the Chief AI Officer of National AI Center, who is also the Director of AI Office of SingHealth. There's Daniel Ting, the smart, handsome gentleman here, so you can just hear what he's saying.
You have to think. Your approach in the technological settings has to be the EMR first approach.
EMR?
Whatever solutions that you're building in the AI or digital space, if someone asks you, do you know what EMR system does this hospital use, and your short answer is no, you're set to fail. So if you come to Singapore in 2-3 years time and say, hey, I have these solutions that is groundbreaking, published in Nature, and when people say, do you know Epic? And you say no, that's it, right? Game over. Same thing for the IT infrastructure and management.
So I'll just stop here. It's just a clip, right? So he already tell you, if you don't know what's EMR and you try to go into the flow, you're going to fail, right? And EMR is just one application layer. You'll see later on EMR runs on the data layer called InterSystems in Singapore. So if you don't know the data layer, especially you want to do an AI project that needs data, you're going to fail, right? Because they have their own proprietary standards as well. Then the next one we hear from Peter Fox.
Sometimes ideas are more
It's a bit noisy, can't get that, but he's talking about ops integration, right? As a group chief digital and data officer, if whatever you're going to tell him, right, is in charge of the entire technology department, you're going to tell him that I'm going to need additional clicks, I need additional people to integrate with my systems. He's not going to take your systems and integrate to NHS because they don't have the time, right? So you need to already do an ops integration. Okay. Then let's hear from Daniel again.
the previous conversation with the farmers, the senior leadership talked about who pays and who gains. And today in life, if you can figure out that question, the adoption rate would increase by 99%. So just imagine that if you're the CFO of SingHealth and NHS, you are currently looking at whether or not I need to use a certain AI algorithms. And today, if your proposal can make the CFO think that, hey, it's either I'm going to generate the revenues or either I'm going to cut costs to still get the net profit. So profitability, whether you're going to be from the public health or private health, from pharma and many startups, is the same.
Okay, so you can hear the ROI, right? That's important. And last but not least, from the VC.
Productization,
Yeah,
how
check.
do you scale, right? Especially if you're developing a device, there's a hardware component, a software component, or you're developing a paralegal. How good are you at getting this product into the market, literally into the hands of the user, the consumer? That's a complex space, right? So performance, production, which is like, can you scale the cost as you increase the volume? Can you distribute the product? And this whole space even includes the regulatory strategy, how do you enter the market, right? And of course, lastly, I call it the practice. So if you talk about healthcare, if the clinicians are not willing to accept innovation, they have some sort of hesitation, or the fact that you're willing to do a pilot, but there's actually no decision at the end of the pilot. Kind of these are the things that we need to answer as part of our due diligence. So that's kind of giving you an insight into how we look at early stage startups.
Okay, so you can hear from all the experts, right? VC, clinicians, chief AI officer, chief data officer, and many others, right? It actually proves that if you don't have the clinician adoption, you don't integrate into the ops workflow, right? For ops tech, you don't have change management, you don't have clear ROI, ownership, any of the things that we saw in the previous slide, and the data foundation, you don't know the EMR, you don't know the Epic, or in this case, Epic InterSystems, then you're not going to be able to make it, at least not in the Singapore healthcare scene. We can easily extrapolate this into other countries, right? They may not be using Epic, they may not be using InterSystems, but again, without understanding what the existing healthcare providers or hospitals are using, it's not going to work. Yeah? Okay. That's it. So the shift needed here, right? So definitely it's no longer, you need to continue in your what you're best doing, your science, your data, your AI algorithm, your innovation, right? But other than that, apart from experimental pilots, right, silo solutions, right, and looking at some vendor-led initiative, you need to move into a production system mindset. So it is a system design mindset that when you launch your AI projects, or startups or companies, you need to already have a system design mindset. Not I'm very good at this algorithm, I launch it and that's it, right? Then, of course, you need to think about integrated workflows, right? Right from the start, how are you going to be part of it? Are you going to just disrupt the industry, which you can, if you have lots of money to burn, like Ping An last time, we actually launched a consumer health platform, right, or like Doctor Anywhere. But other than that, if you are not getting that kind of money or concept, you need to integrate and you are selling to or selling through into the healthcare ecosystem providers, right? Of course, clinical outcomes and the strategy and execution that involve executive sponsorship is very, very important. Yeah. Okay, so maybe before I go to the AI stack, right, we shall introduce you the 4 layers. May I just invite Aristotle, right? I actually gave him a short time to introduce this program because I think I know there are many startups here, you may be interested if you want to get into the AI in healthcare, join this program from NUS School of Medicine India. Over to you, Aris.
Thanks, Jim. Hi everyone, I'm Aristotle from the Digital Advanced Technology Accelerator over at the Yong Lin School of Medicine at the National University of Singapore. So just now Jim talked about many challenges that healthcare faces, and healthcare has a higher bar as compared to other industries because of patient safety, regulation, and the other factors which Jim mentioned. And if you think about it, for any industry, in fact all of you here are from, given that you're not maybe from the healthcare industry, I would assume that in each of the work spaces that you're in, there are hairy and tangled problems which your industry has tried to tackle for the longest time and has had a lot of problems facing. And so 2 years ago, in the School of Medicine, we realized that although there were a lot of hackathons happening, a lot of innovation projects and pilots, as Jim mentioned, going on in hospitals, there was a gap in translation into the healthcare systems. And it can fail for so many reasons. It could even pass through many groups and fail at the end because it doesn't pass a certain criteria or stakeholders' stamp of approval. So with this problem, and given that a lot of effort goes into just creating innovation, but it failing at the last point, it's a lot of wasted opportunity that we have. And during COVID, all of us here would have faced the devastating impact that a disease has globally. It showed a very critical flaw in the healthcare system. There are many interlinked resources, and at any point, if anything breaks, the healthcare system is bullet straight. For example, in Korea, when the doctors went on strikes, it was really tough, right? The ministry stepped in. In the various countries that you're in, I'm pretty sure access of care would have been challenging because with more COVID patients, it puts the business as usual conditions down the priority. And healthcare is something that affects all of us, so we need to get it right. During the peacetime, we need to store our reserves and capabilities so that when crisis strikes, we are able and prepared to handle it. And so that's what we do at the Digital Advanced Technology Accelerator. We want to merge technology with innovation and commerce to create a platform and ecosystem that facilitates more of these solutions coming to market and succeeding. And this is important because without the commercial side, the solutions cannot be sustainable all by themselves. So we do this through an open source approach, which I'll share a bit more later. This is a summary of what we do. We basically run hackathons, getting people in the space and interested to solve problems, because we realize that in healthcare, we need many more perspectives tackling the technical problems that we have. We build ecosystems and the commercializable teams, push them through our startup accelerator. So just now, Jim talked about Zacchaeus Miramar Labs. We are really happy to say that in the first hackathon that we launched, they were one of our winners. They pivoted a lot, grew a lot, and made it through into our startup accelerator. We repeated it in 2025 with an Indonesia company, along with it showing that not only professionals can do this, but even students. In fact, these are two medical students with an incoming computer science student, and they won other hackathons as well. So that was the idea generation part. And once we identify strong teams, we want to nurture them as much as possible to get them through those hurdles that you mentioned, to make sure that they do not face a roadblock right at the end. And we put the startups through a 12-week program to educate them and also get them to meet the right stakeholders. And I guess the last message I want to leave you with is, wherever you are in, be it a startup or a corporate, think about a problem that you are facing, a problem that is so tough that it's at the back of your mind, you've been cranking at it for so long, but you just can't get through it. And if it's a healthcare one, I invite you to join me for the hackathon, and let's probably open source something and take a step at it.
Thanks, Aris. Okay, so like I mentioned, we quite a packed schedule. So this is to introduce you to what Singapore has, right? And it's not only limited to people with medical or healthcare knowledge, right? So I think Miramar Lab will also share later. There's a lot of angle that you can join. And I think Aris also mentioned, right? It's not just a normal mentorship. We say, hey, I meet you, and how should you scale? We actually organize, I'm one of the mentors as well, right? To kind of speak about different areas like navigating the health ecosystem in Singapore, how you actually work with medtech companies, what are the missions looking at, and even we have 22 health ventures, right? At the first batch, we actually say, how do you bring your startup to the US? Because they are US VC, right? So FDA approval, right? Working with the insurance group like the Kaiser Group and others. So it's definitely a very well structured mentorship program, right? Or rather a program that you should actually look at. So feel free to contact Aris later on, right? If you are interested to find out more about this program. Thanks, Aris. Right, so I move on quickly. Again, this is a summarized version, right? So how do you ensure at least a little bit of success, right? Before we even talk about scaling, right? First, you need to be able to launch your pilot successfully. Then you need to increase adoption. Then you talk about scaling, right? So how do you ensure scaling? There are key important layers that I always say, right, in the healthcare AI stack. There are 4 layers. One is the data foundation. We all know, not just in healthcare. Any industry who wants to use your AI, if you don't have the data, you don't understand the data, it's equal to nothing. So the data foundation is the most important, most critical layer that you need to understand. Yeah? And here we talk about unified patient data, you need to talk about the interoperability standards like HL7 Fire Diagram, and many other things. Yeah? Second layer is the AI intelligence layer. This is where you probably is not as big as the Oracle database or intersystem data platform, but you definitely can play in this layer, right? This is where analytics, predictive modeling, your LLM, your RAG, everything you can be building on this layer, but you need to understand this layer first. The third layer is, which we also have a demo later on, is the AI agents. This is, again, you can play in this area because there's so many agentic AI companies or projects that's happening, right? But of course, how do you do it fast enough, right? Do you code everything or by coding everything from scratch? Or do you use some of the workflow automation engines, right? How do you do that? Then the last one is the, I'll say, most difficult, right? It touches not just the technology side, it goes back to what we talked about, the ops stack and integration with the workflow, driving adoption, using change management, getting executive sponsorship. So this is the least technology layer among all these four, but that's also the most important one, that you need someone in the healthcare ecosystem, including NUS data, including some of us who actually work very closely with them to bring you into that ecosystem itself. Yeah. So these are the 4 layers. Let's take a quick look at all the 4 layers. So data foundation, right? So no good AI without good data, we all know that. Okay, so unified patient data, we talked about multiple clinical systems from your EMR, your PACS, your imaging, your lab information systems. So all these things, you need to get the data structure clear. Then you need to understand the interoperability standard because you need to plug into the workflow. You need to know which are the standards you are calling. So if your solution is not, let's say, DICOM, right, compliant, right, they will need to do a conversion. So I worked with one of the big medtech/pharma company before. Their medical device generate a proprietary format, but then the hospital says, sorry, I can't be doing analytics on all your proprietary format. Can you convert it into DICOM format? Right, because I read only DICOM format. So this is where there's a lot of conversion needed. So if you don't do conversion, if you have a new AI project or new AI startup, why don't you go and understand the DICOM standard? If you want to do something related to AI imaging, understand it first, design your product or solution according to that, rather than asking for conversion later on, right? So these are some examples, and of course, AI-ready infrastructure and all. So this is where InterSystems, which I mentioned, they are the US-based company, founded in 1978, right? How many years already? 48 years, yeah? 48 years old company, right? It's still a private company, right? Billionaire founders, still the CEO, Terry, which now the one to go public, which is the right choice, right? So 48 years old company, the whole Singapore public healthcare, all your data is running on this data platform. If you ever go to any polyclinic, public hospitals and others. But they are so unknown. Nobody knows about them because they always hide behind, or not hide behind, not a very good word, they'll kill me for that. They always stay behind, right, in order to get a limelight. But now they realize that there are more things that they need to expose to the market. So we actually work with them to actually bring them to the market and not just always OEM with other applications as well, right? So we can talk more about this. There are a few projects we are running or discussing with them on not just hospital, right? So their data platform, they are definitely, I would say 70 to 80% of their references are in the hospital setting, but they are also in nursing home, elder care. They are used in a big LIS, lab information system, with a big medtech company. They are going into logistics, they are talking to the airports, the seaports as well, because they also have supply chain connectors that's connected to their data platform. So it's started from hospital, healthcare setting, but they are also expanding beyond the healthcare side of things. Yeah? So I'll pass now to Marymount Lab. Zach from Marymount Lab is the co-founder because he's a living example of a successful pilot scaling up and riding on InterSystem data platform and part of the NUS data program. Yeah, Zach.
Hi everyone, I'm Zach. I'm the co-founder of Marymount Labs. But before I get into how we're working with InterSystems, I thought I'd share a bit more about what we do as a company. We are a digital health startup. We came from the NUS Medicine Digital Advanced Tech Accelerator that Iris shared about. And what we're trying to do is this vision of using AI to drive behavior change in patients. And we intentionally start with healthcare and social care because these actions matter the most to patients. And the hurdle to drive behavior change in the healthcare setting is certainly going to be higher than in many other industries. And to set the context for how we are working with InterSystems, as a startup, our first foray into the healthcare industry was actually in the private side, meaning working directly with GP clinics in the neighborhood. And as Jim mentioned, one of the initiatives in Singapore is called Healthier SG. The intention of Healthier SG as a national policy is to shift care upstream from hospitals, from polyclinics to GP clinics, where care can be more personalized. The patients can visit their family doctors to get their medications prescribed. And so, in the realm of Healthier SG, the view is that we want to prevent chronic conditions, and to do so, there are a standard battery of tests, standard battery of vaccinations that these patients can take, and we like to call this as the care gap. Many patients have certain chronic conditions or are predisposed to chronic conditions, and but however, they may not have the awareness or the information to know about these services that are available at the GP clinics. And so this is very much an education problem that we are trying to solve by helping the GP doctors bridge the awareness gap by providing these education outreach campaigns. So going to how we work with intersystems. Within GP clinics, one of the things that we observe is that there are many clinical management systems. There are 5 to 6 main ones, but among the pre-approved list, there are around 20 over clinical management systems. And in fact, some GP doctors are still using pen and paper. So when you have such data fragmentation, if you really do want to integrate with the data sources across all GP clinics, you definitely need a unified data engine to be able to automatically convert all of the different ways data is represented in these different systems. Otherwise, you would have to build individual adapters within your software for each of these systems, and the cost of maintaining each adapter is just going to compound. And that's where intersystems come. Their main product was, of course, to provide the data engine for Epic, but what they also do provide is this interoperability reductions engine that is able to convert and normalize your data so that you can use it readily in terms of reading as well as writing data back into your source systems. And so with the intersystems, they provided us a generous venture grant to be able to build this proof of concept, and we started first with one of the largest clinical management systems used among GP clinics called Plato. And we use that to read data from Plato clinical management system, and this allows us to filter and identify eligible patients as well as their care gaps. And most importantly, through the conversations that we have with the patients, we are able to write back some of this unstructured data back to the clinical management systems. But beyond GP clinics, we realized that the real value that we can provide would still have to be at the public health institutions where patient load is higher. And as you mentioned, I think the view is that we need to take an EMR first approach. So as much as we want to take an EMR first approach, we understand that working within public health institutions is going to be a very long game. That is because in Singapore, data privacy is held to the highest of standards. To gain the trust and to work within the system, it's going to be a very structured process that could take anywhere from 2 years to maybe 5 years, depending on how patient-facing it is, depending on how clinical the use case is. And so even when we engage with different stakeholders within the public healthcare sector, we stress that we are going to build to be EMR ready. And to do so, we actively work with organizations such as Synapse to get onto their healthcare commercial cloud. And so, in our perspective, we try to take what we call parallel validation tracks. So while we're building and designing our systems to be interoperable in the future, to be able to be integrated with Epic down the road, we also know that technical integration is just one challenge. So in the interim, for our product to even be used, we need to prove that it's useful. And that is why we try to collect as much evidence as possible that our population health management approaches do work. And we do so through research trials, through innovation grants, through pilots with these public health institutions, with the view that once the evidence is collected and the parallel technical tracks are done, we will have a solution that is more procurement ready down the road. Wanted to also just quickly share a demo So this demo is of our broadcast platform that is used to send two-way conversational messages over WhatsApp to patients. So this is really a patient outreach tool. But the use case here is a bit different from what you normally expect in healthcare. In Singapore, healthy aging and living well as a senior citizen is two very closely related topics. And there's this whole space of social prescribing where even GP doctors now are supposed to refer senior citizens to their nearest active aging centers. And so we also work with active aging centers in Singapore to encourage some of the elderly folks within the neighborhood to come and join some of these activities, to be more socially integrated in their communities. And so one of the pilots that we had is with this regional social care organization called City Foundation. What I want to show within this dashboard is that the way we use AI isn't to be really patient-facing. It's not front and center. The way we use AI is actually at the back end. Our AI orchestrates the conversations. So instead of having the large language model auto-generate text on the fly, we have a list of pre-approved messages that conform to a specific workflow of the organization. And what our AI does is really to be reasoning at the back end to figure out what the best message should be sent to the patient or the elderly. And in this way, you get the best of both worlds. You get the fluency of the large language model when it comes to reasoning, but at the same time, you are adhering to the strict clinical or social care standards that the organizations we work with have. And so in this conversation, you see that we have automatic intent classification of the messages, as well as this full auditability trace of what the large language model is doing at any given moment, because we know that these audit trails are very important for healthcare organizations who want full transparency into how large language models are really working. And ultimately, what we want to do with such a system is to optimize for certain metrics. And in this case, the metrics that we want to optimize for social care organizations is to increase the participation rates among inactive members, as well as converting some of the non-members into members at these activating centers.
Thanks, Zach. So you can talk to him more to find out more about Marymount Lab and how they have worked with InterSystem. So I actually gave all my guest speakers like an elevator pitch time. So sorry for rushing through. We are like the ecosystem. Yeah. So maybe I move on next. Right. So this is just another example of InterSystems, right? That is in Middle East since we are in GITEX. Right. So they are actually working in Saudi Arabia. Right. So this is using ML to predict the probability that appointment will not be kept. Right, apparently it's one of the problem in Saudi itself, right? So there's a lot of potential AI use cases that you can build. And I didn't have the slide to show today, but feel free to talk to Wei Hao from 59 in front. So InterSystem have a startup program, right? If you get enrolled, you get some money, and you get free use of the platform. You build your AI/ML/innovation projects on their platform, and you go with their marketplace, and they'll take and introduce you to all their customers around the world. So I think it's a very good program to be on as well. And they are collaborating with NUS Data, so you can actually go talk to Aris on that as well. Yeah. So this is the data layer. As I mentioned, that's the most important foundation layer. Without that, your AI is not going to work properly, right? You can pilot, but how you increase adoption and how you scale from there if you don't even comply or write on that giant data platform there. Right? So while we may not be able to, being an individual, we may not be able to build every data platform by ourselves, and there are big boys out there. What we can do as a startup, as a project, we can build things at this second layer called the AI intelligence layer. You can build your predictive modeling, you can have a generative AI kind of things to be done, right? And then you can actually build things that's a lot of analytics-driven research as well as decision making. Yeah. So this is the second layer that if you are a startup or thinking of starting one or doing a project in your company that is supplying the healthcare, something to look at. Okay. So just to give an example from InterSystems, right? They actually work with companies to do this kind of thing as well, very quickly.
Here we have a view of what the clinical assistant front end looks like. So on the left side, we have some query filters. So we can specify which PDF which we want to run the query on, as I've just specified sample notes 2. That's the only thing which I've submitted to the database so far. And then here we have a list of patients which we want to run the query on. And I just choose this meta A. And now we can choose or choose not to run a visit date for which visit which we'd like to do the query for. Here we have guideline source to specify. So for when we run the web search, which source we want to take the results from. And then let's just run a simple query about asking about the medications which this supposed meta A was on. So this is just a simple query asking for a summary of whatever Madam A was on at the time of her visit. And since I specified the visit date to be January the 30th, it'll only take out results from that specific visit date. And so we can see here, this is the patient data, which is taken from the IRIS database. Here we have this one, patient, I've labeled that P1, and this is from the 30th visit. Again, we can see Madam A, again the 30th visit. And in this P2, we see a lot of the medication which is stored in the database. And here's a list of guideline snippets. And this is the answer which the LLM has come up with. As you can see here, unloaded bean, fed bean, and all these, and these are all backed up in this P2 entry in the database right here. And it mentions as well here that it's taken this information from P2.
Yeah. So this one is a good example because it's built on top of the intersystem data platform. So you can actually integrate seamlessly with a lot of electronic medical record systems. Yeah. So this is something that they work with companies to build this together. So if you want to get into this industry, it's one of the partners that you can look at and talk to as well. So that's the second layer, right? More the rank layer. Then the third layer, I also have someone today is representing GPT Bots, which is a Nasdaq listed company, but headquartered in China, right? So plenty of use cases over there for sure, right? But they're Nasdaq listed, so they are not caught in between the China and US problem. So they actually build a lot of AI agents and agentic AI. So I will invite Wei Hao, right, to take over from him. And he's going to show a live demo with it.
Yeah, I'm trying to take in the interest of time. Hi everyone. So let me just go to the previous one. Okay. So in terms of AI agents and application, this is being put in the forefront, and then managing, between us and also the clinician with the care teams as well as with the patient as well. So there are a few things that we actually look into. So one is from a workflow, from a patient interaction perspective. So there will be 24/7 triaging on the symptoms and all the appointment bookings, medication, reminders. So that's one part of it, the use case. And from a clinical copilot perspective, right, there's a workflow automation that can actually help them from an AI agent perspective to help summarize, to help clinicians to actually look into the suggestion as well as evidence. Then from a workflow automation perspective, right, this actually goes into the discharge planning, the referral, then some of the claim analysis, claim submission and analysis. So in the interest of time, let me just go into some of the data. Okay, so there is one, I just go into one simple demo. So this is one of the MedClip AI, and then covers the dashboard, submit claims, and claims verification, as well as AI assistant. So in terms of submit claims, right, so what you can see from here, right, is sorry, and secret. So how the AI agent supports the medical document is they are going to analyze all your documents, and then from there, then reading the contents, verifying and also identifying the medical because typically from a claim perspective, right, it didn't come with all these ICD-10 codes and all those. And all these codes are being suggested by the robot themselves. So as you can see from here, right, based on the claim submission, and then the AI agent will actually support with all these requisites. Okay, that's one part of the use case. From here, then you'll be able to do a claim submission. But even after you do a claim submission already, right, there's a second part of this. From a claim submission perspective, right, a human still need to be in the loop to actually decide whether that claim can be approved or under review or denied. But in this case, how the AI assistant supports is coming up with an AI adjudication report. So when we do an AI adjudication report, what it does is it checks all the information being submitted and then compare with the notes, and to see whether this is what kind of suggestion the AI can actually come back. And the whole thing, right, is to augment the human decision rather than decide for the human. Okay, so this is actually to support the human. Let me see. Is it analyzing? Okay, so as you can see, right, after the report from an AI adjudication report actually covers some part of a documentation review, then what kind of information that they are suggesting, verifying the codes, and doing the few kind of risk assessment, amount assessment, and also do some recommendation. So remember, the whole AI agent, right, is not there to replace the human, but to augment the human decision. So this is another part of support from an AI agent perspective. Then last but not least will be more from an AI assistant perspective. So this is more from medical claim. So some of the sample questions are also being suggested as part of this AI assistant. The person can actually look into that and then get some inquiry, direct response from an AI assistant perspective. So in short, 3 different areas: submit claims, claim analysis, and also an AI assistant. Okay. Other than that, just now we are also looking into 24/7 symptom triaging. So of course, the other part that AI assistant comes in, right, is to interface with the patient directly. So when a patient asking about simple terms, they figure what to do, and then from AI agent perspective, they are being trained to actually suggest what is the next step, and then what kind of symptom, and then at which point that they should be going to the doctor. Okay, this is one generic part. Other than the generic part, right, the other part will be escalation part. So from an AI agent perspective, right, there's still a fallback. Because at the end of the day, from an AI agent perspective, they can't handle everything. When they detect there's some escalation to be done, they will need to send it back to the care team, so that the care team can actually look into the proactive call and then calling the patient themselves. So in this case, right, there are other AI agents doing behind the scene to actually summarize the past clinical summary. So instead of a clinician, instead of a care team looking into this directly, it is being done by the AI agent supporting the clinician. Then other than that, would be looking into what are the missed medical, looking at the other things. So in this case, right, what you can see is detect the critical case, pass to the live care support, and then go back to the patient and then tell them what is the next step. Alright.
Okay, thanks, Wing Hao. So you can see very packed schedule because we have so many good demos that you can discuss with them. So I just want to show another one that is our partner from Korea, right? So they actually built this real-time support for clinicians, as I mentioned, and as you can see from Paramount Lab, from GPT Box, they all integrated into the hospital workflow and everything, right? This is another one. It's a real-time support for clinicians. You can see he's speaking, actually I don't know what language is that, sorry. but it's auto translation into English, Chinese, and many other characters, right? And this is the doctor, it's our partner called Mike, right? And you can see you probably can't hear clearly, but it's not speaking English, right? That's the language that he's speaking, translate into English. Right? So a doctor, right, can actually serve patients, not using English as well. So it's speak in English and auto translate into the language that the other party is using. And he can pull out, because the integration is important, he can pull out the different medical records, the PACS, the images directly from the system itself. And this is already integrated, right? So they don't need to call another window, log into another system to be able to do all these things. So that's the importance of integration into the clinical workflow. You probably can't hear very clearly, so I'll just speak a little bit. But basically, you can see it's a real-time support for clinicians, right? On real-time translation, real-time pulling out of the information, including the images, and of course the medical history and other things. And of course, towards the end, you'll see real-time doctors, the clinical documentations, because every time you cannot read the doctor's handwriting. So this is all done by the system, by the AI system itself. Yeah? Okay. So we have seen 3 layers. First layer, data foundation. Second layer, AI and intelligence layer. Third layer is the AI chatbots. And I say, if you want to start a project, you want to do probably a company, you can look at second and third layer, because first layer usually are for the big boys who actually build big data platforms. The fourth layer, again, I say is the least technology related, right? Because it touches a lot about executive sponsorship, strategy, go-to-market, as well as change management. Yeah, and you need people who really understand healthcare. So if you don't, then it can be difficult if you want to launch something in the healthcare industry. So we will look at the integration, which you need some kind of SI, system integrator help. You need to have people who understand the healthcare setting, right? Many of the startups actually hire or get doctors as part of their board member or as their founders team, right? That's one way. Of course, another way is doctors don't have much time. So another way is you work with people like us who know the healthcare ecosystem very well and work in the hospital system before to help you to integrate it in. And we don't just do the technology side of things, but also the change management and the strategy side of things as well. Right? So this is what our company, so we how John and myself, we are from 59 Social Techno Ventures, right? The name suggests that we use technology to create positive social impact. That's why it's called ST, Social Techno Ventures, right? And what are positive social impact? We focus in 2 key industries, healthcare and education as a start, right? So that's where we started in 2017. But of course now we expanded into some other areas and industry as well, right? So we work on strategy architecture, right? Go-to-market, business consulting. Many of us are ex-consultants from the known consulting firm like Accenture, McKinsey, Boston, right? Then you have vendor orchestration. You can see we can bring in different ecosystem partners to help you with that. We do implementation as well. We have partners who are actually doing like 28 years in the public industry, public sector in Singapore, right? And of course we have partners in Switzerland, we have partners in India as well, right? Change management, I think that's what is most important, because how do you increase adoption and some other things as well. Yeah. Okay, so if I would summarize everything, right? So we look at it, data, you can work with in the system as one choice, especially if you are working in a country that the EMR is running on intersystems, or if you want to get beyond healthcare. Right? Intelligence layer is something that you probably can build, because I know many of you are building AI projects or companies. Agents, you can build as well, but you can work with GPT bots. So although we have shown you the GPT bots just now, but GPT bot is actually a platform, right? It doesn't really build a lot of applications. You work with partners like us and maybe yourself to build applications. So they are platform. Right? Then of course workflow and outcomes, that's where our company's 59 Social Techno Ventures, or you can call us 59, right, that can help you. Yeah? So AI is actually not a model, it's a system, right? Hopefully you see by here, right, all the discussion we have. Okay? And I think a small topic, healthcare is highly regulated. Most of the data cannot go out of the country. So data privacy is important. Singapore, you have PDPA, Europe, you have GDPR. All this compliance needs to be there. Regulatory, if you touches anything that is clinical related, you need to get US FDA approval, your Ministry of Health approval. Singapore will be HSA, Indonesia will be BPOM. You need to be able to provide audit trail for every AI consultation, recommendation to decision. Right? You need to look at what kind of things can go to the cloud, what kind of thing has to be on premise, what is on public cloud, what is on private cloud. Right? The model has to be explainable, which is like explainable AI, which is not surprising, and more so in the healthcare industry. Right? And then there will be continuous monitoring and looking at the training of the data. Okay? Quickly, I don't know how many of you are from Asia, but there's lots of opportunities here. Singapore alone, we just launched where the Prime Minister, Mr. Lawrence Wong, is sitting as the chairman of the entire AI initiative, national initiative in Singapore. Right, we've launched what we call Lorong AI also, which is getting a lot of companies want to do AI. So Singapore alone is a lot, but we also see a similar trend in other countries in APAC. Right, so the total market for healthcare AI only is 45 billion in the next couple of years. So catch this 10, right, total addressable market. And of course, there are some benefits we have as Asian. Right, we have less clinical system lock-in, just like how we live from other technology, right, from 2G to 3G to 4G, 5G, right, in some other countries. The more developed countries have problems because of legacy. We have less legacy, right, so we can live from. We have a lot of national platforms, as I shared, in Singapore, National Electronic Health Record, Indonesia Satu Sehat, Malaysia My HDW, Thailand HIE, plenty of national platform that is actually going to the entire longitudinal health records. We have a very vibrant and healthy startup ecosystem. You heard from Aris already from Data, right? This is one of that program, but there are many government-led, private-led kind of ecosystem in Singapore. And of course, you can go through my colleagues from 5-9 that we actually can link you up and also work with you if you are new to Asia itself. Yeah? So us like ecosystem is important. We know that in any innovation, including AI. But ecosystem, can we break down each of this word into what you need to remember, right? So what is E? Environment. You need to have your regulatory environment, cultural. I have a video that might talk about culture when we launch in Latin America. It's very different, right? Culture is important, market readiness. C is clinical workflows. We talk a lot about that. O is organization. You need to have an executive sponsorship, the ownership, the governance, system and data. We'll talk about it also. U, the ROI is very important in any startup, not just AI or any project, right? S, another S is startups and partners, right? We also talk about that, right? Technology is important, which most of you will be very familiar with. Right? E is execution. We can talk a lot, we can build a lot of models, we can do a lot of POC. When you don't execute it, you don't increase the adoption, you can't scale it. Right? And last but not least, there will be continuous monitoring and measurement as well. Okay, so my last slide, right? Well, a bit of selling still needed. So talk to us. We actually have a lot of ex-CXO in our company, right? CISO, CIO, CDO, CTO, C1, all they can mention in the big enterprises as well as the startup companies, right? We are working with multiple partners, including InterSystems, GPT Box, right, and many others to deliver solutions and integrate them into the ecosystems. Right, we have end-to-end delivery. We are not just technologies. We actually have a lot of the strategy and go-to-market side of things and business consulting side of things. And last but not least, we actually embrace the entire ecosystem. And so we bring so many people in to talk to you today, so that depending on your interests and your priorities, there are different people you can talk to today. Okay, so let's build a real healthcare AI system that can increase adoption and scale together. Thank you very much. Yeah, you can reach to me at info@59socialtechnoventures.com. Thank you very much for listening. Yeah, thanks.
Yeah, these are car present.